Hi everyone, welcome to researchmd.com. Another great topic today, treatment of asthma in pregnancy. Okay, very common, one of the common diseases in pregnancy is asthma. So we're going to teach you very important topic, like how do you approach the patient with asthma and all that. Again, my name is Pramil Cheriyath. I'm a program director in internal medicine and the transitional residency. I teach medical students and residents on a regular basis, director of research. I also, assistant professor of medicine to large medical schools also. Okay, so let's get into our topic. What is the first thing? When you talk about just briefly of asthma, we said like one of the most common disease in the pregnancy, right? Very important. What are you trying to protect the baby, right? You need to make sure the adequate oxygenation fetus and the mother. So hypoxic episode is the one causing a lot of problems. So you need to make sure we watch all the symptoms. And 1/3 of pregnant women will be asthma symptoms if they get. 1/3 will see asthma symptoms stay the same, and 1/3 of the women, if you look at it, women will see asthma symptoms improve. So if you look at it, change in asthma severity, that's like a good picture over there on the right side. Okay, only when you look at the pathophysiology, I think the main thing we need to act is immunological changes and the role of natural killer cells and the T cells. Okay, they're immune mediate, the alteration and the enhancement of the allergic and asthma response. This is the main thing. You get a nice slide up here telling about the role of the natural killer cells and the T cell activation. Those are the immune mediate alteration in the fetal growth and the in the allergy and asthma response, and also you got all these hormones also come into play into that. So clinical assessment, how do you make the most important, the easiest thing to do is what? Peak flow measurement, right? And then you can do pulmonary function assessment. There's a lot of small equipment now. You don't have to do the full study. And then you also need to worry about the fetus, right? Serial abdominal examination, starting at 32 weeks of gestation to look at it like, premature growth and those kind of things will be important. And so important to see what happens in the what is the natural history, or what happens in the lung function during the pregnancy. Okay, number one, reduced FRC and reduce RV and increase inspiratory capacity. Okay, then always also there's increased minute ventilation also. So the main thing, decrease FRC, decrease RV, and increased inspiratory capacity. Okay, forced expiratory volume and vital capacity remains preserved. Let's say if you have FEV1, FEVC reduced, then always consider there's a respiratory pathology. It's not, it's not due to pregnancy. So don't blame everything on the pregnancy. So that's what you want to get out of this slide, okay? What reduced FRC, reduced RV, increased inspiratory capacity. This is the most common finding in there. And the classification also important. If you've taken the test, definitely they're going to ask you to classify asthma classification, right? So we just kind of go through really fast. There's something called, you start with the intermittent and the mild persistent, you got moderate persistent and severely persistent, okay? Depends upon the symptoms. That's why they do the step-up treatment and all that. You have to look at it, let's say intermittent, okay? Symptoms are less than 2 days per week, and the sleep interruptions also come into it. Less than 2 times per month, normal activity, no impact, and the peak flow is greater than 80%. And mild persistent, you got greater than 2 days per week, 2 times per month, minor limitation on normal activity, and the peak flow remains or peak flow FEV1, FEV1 FEZ ratio, around less than greater than 80%. Okay, and the moderate persistent is symptoms every day, and the sleep is interrupted once a week, same limitation, and 60 to 80% the peak flow or FEV1 FCV ratio. And severely persistent throughout the day, sleep interruptions greater than 4 times per week, and extreme limitation, and the peak flow FEV1 FCV ratio is less than 60%. Okay, so it's very important to know those classification, very important. So treatment, if you need to know, inhaled corticosteroid is the most beneficial. Okay, and the studies have shown it's not toxic to the fetus or any of that. Okay, so budesonide. So if you have to take one drug out of this presentation, remember budesonide. Okay, that is the inhaled corticosteroid, very safe in pregnancy. So if I'm writing an examination question, definitely I'm going to write that. Okay, you can also use albuterol, short-acting beta-2, and they are also very safe. So this is like one of the classification. I mean, how do you approach treatment? Okay, so if the symptoms are like continuous, or like when you talk about the fourth stage, when we did the severely persistent stage, your treatment options are high dose inhaled corticosteroid, and then you do long acting inhaled beta 2 agonist. Okay, those are the main treatment for severely persistent. That is the number 4. Continuous symptoms. You can also, in this patient, like if they don't improve, you can start like small dose of oral steroid. Theophylline also has a role in it. Okay. Now let's come to the third, which one is the moderately persistent. What do? You still do you do medium dose inhaled corticosteroid, and then also you can do like a long acting beta 2 agonist. Okay, those are the main treatment. So when you have like number 2, or which is the mild persistent, symptoms only like greater than 2 days per week, and sleep is interrupted only greater than 2 times per month, what do? Preferred treatment is you just do like low dose inhaled corticosteroid, preferably budesonide, and then that's the only thing they kind of need. And they can do like short acting beta 2 agonists only if they have like symptoms and all that, right? And then the last one is the intermittent, or like symptoms are like really low, and you just kind of monitor them and see like how they do it and all that. Okay, and then it's good to know like what the FDA rating for prescribing pregnancy. Like if it is appropriate human studies, no risk, studies have shown no, so any drug is classified A, so you can use it. Okay, when the classification B, insufficient human studies, but animal research is safety, suggests safety, but not enough studies in the humans show safety. When you look at C, insufficient human studies, but animal studies show problem or defect or like any complication, so don't use C. And D, human studies with or without animal research show fetal risk, but the drug is important to some women to treat their condition. D means like of course it's going to have complication, but the last resort, you look at the risk versus benefit and you can use it. X, don't use it at all. Fetal risk, very known, and that's like you're just killing people when you use that. Okay, recommendation also, global initiative from asthma is also given, counsel and the risk of poorly controlled asthma, and then advantage of actively treating asthma during pregnancy like strongly outweigh any potential risk of standard asthma control. During pregnancy, monitor asthma symptom, monitor respiratory infection, inhale corticosteroid use. Remember, budesonide, okay? And low priority should be placed on stepping down treatment until after delivery. So those are the global initiative of asthma. What are the complications you need in oral steroid? I mean, try to avoid it: preeclampsia, cleft lip, cleft palate, low birth weight and prematurity. And the potential complications, maternal is very high, hypoxemia, preeclampsia, spontaneous, spontaneous abortion. Then you got the fetal complication, premature growth, intrauterine growth restriction, all of this like neonatal death and all those kind of happen. Okay, so it's very important to control asthma in pregnancy. These are my references. Thank you so much for watching. We'll be back with another presentation soon. Please subscribe to our channel.